right. Hey, everybody. Welcome back to Dr. Cece Says Facebook Live. And I know I missed last week. And y'all, I missed y'all. I did. I missed being on the live, but I needed to disconnect for a little bit. I needed to reset. I needed to rest. And you all can't see the whole shirt, but I have on my heavy on the protecting my peace shirt today because I am always heavy on protecting my peace. And so, after all the things that happened over the last couple of weeks, all of the horrible events in Texas and California and in Buffalo, New York, I just needed some time to kind of just disconnect and try to, just center myself. But I'm back. So, y'all, let's continue to pray for the families and the communities that were affected by all of the horrible, evil acts of violence that have happened, and all the ones, unfortunately, that we know will happen. Let's just keep people in prayer, and also let's figure out what we can do to make some changes, so we don't have to just keep giving thoughts and prayers, but that there's also some action that follows as well. Okay. So I see I got a couple of people on. Guys, drop hey in the chat for me so I know who's here. And as usual, I want you guys to talk to me. So I'm gonna give you a lot of information tonight as we, kind of finish up our mental health awareness series. So I wanted to actually talk about the who, the how, and the when of mental health services. But it's always a conversation. So you all drop questions, drop comments in the chat, and I will be looking for those. And before we get off, I have a special announcement that I wanted to talk about a little bit more. So make sure you hang out with me until the end so you hear about the special announcement. All right. So while people are dropping hey in the chat, tonight, like I said, I wanted to finish up our mental health awareness series, and I want to talk about when, who, and how of mental health services. So when do you seek services? Who do you seek services from? And then how do you seek those services? Okay. All right. I'm just going back and forth here between the comments. Okay, so let's start with the when. So, like I've said before, you guys have probably heard me say this plenty of times. Anyone can benefit from therapy. Anyone can benefit from mental health services because mental health services, such as therapy, is meant to help us be our best selves, right? There doesn't have to be anything wrong with us, right? A lot of times folks will say, oh, well, you go to therapy when something wrong with you. There doesn't have to be anything wrong with you for you to go to therapy, right? That's a negative and a really damaging idea that's pushed in a lot of our communities. And it really keeps us at a disadvantage, right? When we think about it, because therapy is a coping strategy. Therapy is a tool, it's a technique, it's a resource that helps us figure out, where we're going and what's the best and the healthiest way to get there. So when we have this mentality that, therapy is bad or it's just for bad people, then we are going to shy away from it. There's going to be stigma around it, and that doesn't help us. It doesn't serve us. Hey, JJ Culpepper. I see you put my first and my middle name. Okay. Yeah. So when we talk about when we can go to therapy, you can go to therapy at any given time, right? You can go for guidance. You can go for transitions. So, for instance, a teenager that's graduating from high school and trying to navigate going to college and being what we call an emerging adult. Emerging adult means that, by law, you're probably an adult, but you haven't navigated life enough to actually do everything on your own. So, you're emerging as an adult, right? That's a good time for teenagers and young adults to be in therapy because they have a lot of decisions to make, and the world is telling them that their parents should not be making decisions for them, but their parents have been making decisions for them. So I always tell my patients, when you turn 18, right, nothing happened in between 11:59 p.m. and 12 o'clock a.m. on the day that you turn 18 that gave you the ability to know all things and be able to do all things by yourself, right? They still have to learn how to navigate. And even us as at 40, right? 30, 40, 50, we still have to figure out how to navigate some things. Therapy can help us with that, right? Now, of course, therapy helps us with things like anxiety, depression, all those things that we talked about in week 1 of the series. But therapy can also just be supportive. Therapy could also be for guidance. Hey, sis. All right. So, real quick, and this is something that I hear a lot, y'all, and it really hurts my heart when parents say things like, if you don't stop acting up, I'm going to send you to therapy. All right. Now, parents might not mean it that way or the way that the kids take it. But a lot of times, what that says to the kid is one, something's wrong with me. And two, they're sending me here as a punishment. So, parents, please, please, please do not talk about therapy in that way because you're really setting your kid up to be resistant when they come into treatment. And so now they're coming in, they don't want to tell us anything. They don't want to share what's going on in their life. They don't want to talk about emotions because they think that they're there as a punishment. They think that they're there because something's wrong with them. And nobody wants to feel like something is wrong with them, right? So, what we really want to say is, hey, it seems like you're having a hard time. We all have hard times, at some point. Let's go and talk to somebody that maybe can help us with it. Right. So, still going to therapy, but that's a softer approach and a more accurate approach as well. Okay. Now, plenty of people out here go to therapy because they want an unbiased party to help them with their concerns, or they want support navigating difficult times, or like a loss or a death, right, in the family, right? Or sometimes people just want to go to deal with stress. So there's a diagnosis called adjustment disorder. With adjustment disorder, all we're saying is there is something going on in your life that you are not adjusting to well. Y'all, that could be any of us at any given time, right? Think about the last 2 years. We've been in a pandemic for over 2 years. There are plenty of people that did not adjust well to that and are still not adjusting well. All right. If you all can feel that, like if you can say, yes, there were times during this pandemic I didn't adjust well, drop me in the chat. Okay. Yes, sis, definitely. Yeah. Now, there are situations or symptoms that people might tell me about, and y'all, I get questions all the time, and I love it. I really feel honored that people feel comfortable enough with me to come to me and ask me about these types of things, right? So if you ever have questions about, how to get help or should you get help, drop me a DM, right? Or if you are close enough to me, call me on the phone, send me a text message, right? Because there's nothing wrong with using the resources that you have. And I tell folks, there are not a lot of, black clinical psychologists. There just aren't, right? So if you know one, use the resources you have. So a lot of times people will say to me, let me tell you about these symptoms, or let me tell you about this situation, and you tell me what you think I should do. Okay. So I wanted to give you guys an idea of some of the things that would make me say, yes, you should go and see a professional, right? At least go and do an assessment and see what their professional opinion is. Okay. I see I got some me's in the chat. Yeah. A lot of us, right? Me included, did not adjust as well as we would have hoped, right, to this pandemic. So I'm in that boat as well, y'all. Okay, so one of the things I look for, I listen for when people are telling me, what's going on for them is dysfunction. And, that word sounds real harsh. All it means is that whatever you're experiencing is causing you to not function at the level that you're used to functioning at, or it's causing you to not function at a typical level, right? So, for example, let's say you are having symptoms of anxiety and you tell me, well, I stopped going to certain places like the bank, right? Or the grocery store because I get so upset or I get so afraid while I'm there. That's not your typical level of functioning, right? You used to be able to go to these places, and now because of intense emotions, you're not able to go, right? That would be a reason to go and seek professional help. If we're talking about kids and you said, okay, it took us 2 hours to get out of the house because my kid was, upset and emotional and crying because they really did not want to go and play this baseball game, but they're on the team. They have been playing baseball, right? And so, it took us 2 hours. We ended up missing the game. That's a level of distress that is not typical. And more important, that's not where you want your kid. You don't want your kid suffering like that, right? So, in both of those situations, I would recommend going to see someone, letting a professional complete an assessment, and then figuring out where you go from there. Okay. Now, there are other things and other situations that I hear about where I'm going to be more forceful. So, one thing about me being a therapist, I have learned how to be very relaxed with my opinion. All right. So, people will tell you 9 times out of 10, if you don't ask for my opinion, you won't get it. Not because I don't have an opinion, but just because that's not necessary. Right. So, also know this is just a side note. Mental health professionals, people that have been trained in mental health, they are not going to tell you what to do or what not to do. They're going to help you see the pros and cons of the decisions that you have available. They're going to point out patterns to you. They're going to be able to say, oh, well, people that usually do this, this, and this sometimes are dealing with this, this, and this, right? Because it's not our job to tell you what to do, right? It's our job to help you come to a conclusion for yourself. So if you are, working with someone and they are telling you you should do this and then do that and then do this, I might be side-eyeing that a little bit. Okay. So just a side note. But anyway, there are some situations where I will be more forceful with my recommendations. So if you say anything about self-harming behaviors, that's going to be cutting, burning your skin, hitting, punching yourself, anything where you're purposely causing harm to yourself because of the emotions that you're feeling. Those are significant symptoms, right? And they require professional intervention pretty quickly, right? As soon as possible. So definitely going to say, hey, we need to get you to see someone or we need to get your kid somewhere. Passive suicidal ideation, right? So passive meaning there's no active plan to hurt or kill yourself. There's no intent or desire to die at the time. But there are what we call these kind of passive suicidal thoughts. For instance, what would it be like if I wasn't here? I wonder if life would be easier for my family if I wasn't here, right? Those are more passive types of thoughts. What that tells us is that that person is experiencing distress and they need some help with it, right? So that's not saying, oh, you're going to have to go into the hospital and you'll be in the hospital for 2 weeks or whatever. It doesn't have to get to that place, but it is saying that there does need to be some type of intervention. Now, active suicidal ideation, there's a desire, an intent, and or a plan. I don't need you to have all three. Two of those really would be enough for me. Really, sometimes depending on what they tell me, one will be enough for me, right? To get you immediate help. So if you tell me, yes, I want to die and I plan on doing something about that as soon as I can, we're going to seek emergency services immediately, right? That's non-negotiable. My kids know that up front. They know why I'm doing that. They also know that I'm going to be there with them every step of the way, right? So one reason I'm doing that is because I'm mandated by law to intervene. But even if I wasn't mandated, I would still want to give them as much help as I can, as soon as I can, because we want everybody to live and thrive. And we know a lot of times these feelings are fleeting. We just have to keep you safe long enough for your feelings to change, right? Sometimes that might take some hours. Sometimes that might take some days. But it will happen as long as we can get you to help. Okay. So y'all talk to me in the chat. If you got any questions, let me know. Hey, Marcella. Good to see you. All right. So, y'all, I kind of dropped some heavy stuff on you right there. So, again, if you have questions about any of that, let me know. But the point here is to get help before we get to the place where it's an emergency, right? We want to get help before there's active suicidal ideation or there's a plan to actually do harm. And the way that the world is right now, there are plenty of people that are discovering the need for mental health treatment. And so a lot of places have wait lists, right? So you can call and say, hey, I want to get services. And they might say, ma'am, sir, we need to put you on a list for about a month. We'll call you as soon as we have something. So I always urge people, start this process early, right? Because again, you're just going in to say, hey, I'm trying to see if I need some more professional intervention. So nobody is obligating you to do anything just because you have that first appointment. So if you all are thinking that you need some help, if you're thinking you know someone that needs some help, try to get that sooner rather than later. Okay. All right. Yes, sis, prevention, definitely. Now, let's move on to the who. So, you all know this part is really important to me because, especially in our community, and when I say our community, communities of color, we already have our apprehensions, right, about doing mental health. Or really any type of health care, right, or prevention. And so I want everybody to have the best experience possible the first time, hopefully, or as close to the first time, right? Because what I hear a lot is, oh, I tried therapy, it didn't work for me. So it probably wasn't that therapy didn't work for you, that therapist might not have worked for you, or it wasn't quite the right time for you to be in treatment. But there are so many different types of theoretical approaches. There are so many different types of personalities and different types of people. At some point, you should be able to find someone that will work with you well, someone that you match with. And we'll talk about match a little bit more in a minute. But, if we can make sure that we are getting with people that are trained and people that are a good match, you really should have a good experience when it comes to treatment. Okay. So when we talk about who to go to, we want to make sure that they're a mental health professional, somebody that has training, somebody that is either licensed themselves or they're working under someone with a license. So, we talked about that, I think, the first week, right? So we have postdocs, we have interns, we have people that just haven't become licensed yet, but because of the way that our stuff is governed, they have to have a supervisor. Their supervisor has to have a license. So you are not dealing with people that are unlicensed and unregulated, okay? And you always have the right to ask about their license and to ask about their supervisor's license as well, okay? So, if we're talking therapy, we're talking about psychologists, we're talking about licensed professional counselors, clinical social workers, mental health counselors, marriage and family therapists. Y'all, there are tons, okay? The main point is that they have training and that they have licenses or they are working with someone with a license. If you're looking for medication management, because sometimes these concerns and these symptoms that we're talking about are so intense that they really need medication in addition to therapy. And I always recommend, if you are taking medication for a mental health concern, you should also be in therapy. So if you're looking for medication management, you're looking for a psychiatrist, you're looking for a psychiatric nurse practitioner, and sometimes even primary care physicians. And the reason I say sometimes is because a lot of PCPs or primary care physicians will refer you to someone that specializes in mental health, right? And so again, that's going to be a psychiatrist, psychiatric nurse practitioners, mental health nurse practitioners, okay? Now, thank you, Bay. Yes, hashtag ask about the license, definitely. So the how. Y'all, this is the tricky part, right? Sometimes it's really daunting to find the services that you need. If anybody, knows about that, drop, me in the chat, right? And it doesn't have to be for you. You all might have heard this from other people, right? You might have tried to get services for someone in your family it can be really difficult to find exactly what you're looking for. There are so many different types of services out there. There's so many different places. And then there is, like certain barriers like money, right? Because these things cost a lot. And Marcella, yeah, thank you. So let's talk about if you are going with insurance. If you want to use your insurance, sometimes it's helpful for you to start with your insurance carrier. So you can call them, you can ask them to send you a list of mental health providers in your area that accept insurance. Okay, and you can at least take that list and that narrows down like what you're looking for, and then you can kind of start there. You can also ask a primary care physician because a lot of times they have relationships with mental health providers in the community, and so they can kind of steer you in the right direction. If you are close to a major university, so University of Alabama at Birmingham, University of South Alabama, University of Tennessee, University of Georgia, University of Michigan, right? All of those types of places usually have a psychology clinic or a counseling clinic on the campus, right? And so they will, of course, have services for students, but a lot of times they will have services for people in the community. And sometimes those services are on like a sliding scale because they are not taking insurance, and also because you are working with students or trainees. And again, remember, those trainees have multiple supervisors. So you're not just getting an unlicensed person, you're getting the trainee who is also talking to, consulting with multiple licensed professionals, right, on a daily basis. Now, you can do an internet search, right, and look for mental health providers that specialize in whatever symptoms you're experiencing. What you want to do is make sure you ask questions and make sure that you are comfortable with their approach and comfortable with them. Okay. There are plenty of people that have knowledge and training, but that doesn't mean that they would be a good match. And match is important. We actually have tons of research that says the match between the therapist and the client or the patient is really the most important part of the therapeutic process, right? So there are people that do what I do, like cognitive behavioral therapy, dialectical behavioral therapy. There are people that do psychodynamic work, okay? Most folks will tell you psychodynamic and cognitive behavioral therapy are pretty much opposites. They're really not. There are some things that are similar about them, but they are two different approaches, right? That part doesn't matter as much when it comes to your progress as you having a good match with your provider. And the reason that that's important is because if you have a good match, then you trust that person. You're more likely to listen to that person. You're more likely to share the things that you really need to share to help us make our conceptualization and give you good information, right? You're also more likely to attend therapy consistently when you have a good match. Now, some people will ask me, does match have to be like a racial match, right? So will a black, a client match better with a black therapist? Sometimes. Sometimes that's not necessary, right? And more importantly, there aren't that many of us. Okay. So I can't see all of the black patients that come through my clinic, right? So I have to make sure that my trainees are culturally humble, right? They have cultural humility. So they're able to still make, bonds and make connections with people, even if they're not the same ethnicity or the same race. So it would be nice if everybody could match on race. Everybody can't. And it's not necessary for everybody to do that. You just have to feel comfortable with that person and you have to feel heard by whoever it is you're seeing. Okay. Okay. Now, if we're talking about the babies, right, the kids, you can check with pediatricians. Again, they usually have a good sense of who's in the community, and they might even have a good relationship with some therapists. You can also check with school counselors because they a lot of times will have information for providers in your community. And you can check with the insurance company. If you are looking for child providers, you want to say that because everyone won't see everybody, right? So, like, I am a child and adolescent and family psychologist. So, my age range is pretty much about 5 to about 25, 26. Can I see adults? Yes. Have I seen adults? Sure. But I prefer to see from about 5 to about 25 years old. All right. And so when you are trying to figure out if this is going to be a good therapist for you or a good therapist for your child, you want to ask them, like, who makes up your clientele? Is it mostly kids? Is it mostly adults? What is it that you specialize in? And you all, like, making sure that you ask questions is so important because this is a part of your health, right? This is a part of healthcare. And so we have to advocate for ourselves in every type of situation. So the main part of this is starting early. Like I said before, most places are going to have wait lists. And that's just because there are a lot of people that need services right now. And the way our world is going, a lot of people will continue to need services. And so if you're concerned about what you're feeling, if you're concerned about your child's behavior, go ahead and start the process. Okay, you want to do it before it becomes an emergency, right? We want to help our kids as early as possible. We don't want them suffering through. I've had a lot of kids that, by the time they got to me, they're like, oh, I had this issue for the last 2 years, but we weren't sure if we needed to come to treatment. And that hurts my heart because I'm like, oh, they've been suffering. Now, did they do okay? Were they, I talked to you all about existing versus living. Were they existing? Sure. Were they getting through school? Were they getting through, extracurricular activities? Sure, they were. But they were also dealing with some stuff that they didn't have to deal with. And so, let's make sure that we are looking, we're watching, and we're listening to the kids. And also watching, listening to ourselves, right? Don't discount whatever you're going through. Don't discount what stress can do. Because as I told you all, I think in my very first live for Dr. CC Says, right, one of my dad's favorite sayings, if stress can burst a pipe, what do you think it'll do to you? All right, so let's make sure that we're not taking for granted that we can just keep moving and keep pushing and everything will be okay. All right, so takeaways for tonight. Hubby, make sure you get these down in the chat, okay? Takeaways. Anyone could benefit from therapy. Anyone can benefit from therapy. Therapy is a tool, it is not a punishment. Start the process as soon as you can instead of waiting. And make sure you are working with a trained professional that you also feel comfortable with. And hubby, I know that was a lot, so I'm going to say it again. Anyone can benefit from therapy. Therapy is a tool and not a punishment. Start the process as soon as you can. And make sure you are working with a trained professional that you also feel comfortable with. Okay. And hubby, if you didn't get all of that, that's okay. I'll drop it in the chat as well. Now, guys, before I go, I wanted to tell you about my Memorial Day giveaway. Okay, so I went live on Memorial Day and I've also posted about it a little bit. I think I posted yesterday and today, but I wanted to make sure I told the Dr. CC Says crew. Okay, so I am giving away 3 of my workshops to 3 organizations or groups. Okay, these workshops are valued at $3,500 each, and I'm waiving that fee, so they will be free. FREE, free. Okay. These workshops are focused on authenticity. So we're talking about how do you live an authentic life? How do you find your voice? How do you lean into your magic? And for those that missed my live on magic, magic is your mannerisms, your approach, your genuineness, your identity, and your core values. So that's an acronym that I came up with to kind of help people understand how do you figure out exactly what is amazing about you and how do you lean into that? How do you use that as you go through your day-to-day life? So that's a pretty awesome workshop that I'm really excited about. It's a lot of fun. And also, how do you fill up your space? How do you have that main character energy? Because you all do know you should be the main character in your life, right? You shouldn't take, back seat or second fiddle to anybody else when it comes to your life. So all of those are my workshops around authenticity. And then I also have workshops around self-care. So the self-care workshops are usually geared towards healthcare professionals and caregivers. So the deadline to enter the giveaway is tomorrow night at 11:59 p.m. Eastern Standard Time, and I am going to contact the three winners on Saturday, June 4th. Okay. So if you're a part of an organization, whether it's your job, whether it's a church group, nonprofit organization, community service group, right? If you think that they could benefit from my workshops, please sign up for the giveaway. Okay. Because again, it's free. They're valued at 3,500 and they're free for right now. Okay. If you don't think you could use it, but you know someone who could, please share the link. And I dropped the link in the body of the live tonight. So the link is there. So please share the link so they can sign up. Okay. All right, y'all. So that's it for tonight. Join me next week. I have been told that I might have a really special announcement next week. And so I'm excited about it. We're going to have some fun with it. So definitely don't miss. Okay. You all be safe. And I will see you same time, same place next week.